Thank you and good morning, everyone. Thank you for joining us for the COVID-19 vaccine webinar. This webinar is going to be paneled by our medical director, Dr. Wong, one of our stellar nurses in our outpatient and residential programs, Sandra Friedman, and for questions and answers, myself, Dylan Javanfard, Division Director of Residential and Substance Services. If you can, throughout this vaccine webinar that we are having, please be mindful to post your comments or your questions into the chat box. I will be moderating those, being able to provide those back to our team. We're going to share some information about the vaccine overall. We're going to share some stories and some information about people who've received the vaccine so far and answer as many questions as we can. This recording itself is also being recorded so that we can then post it to the Didi Hirsch website and have people reference back to this as needed as well. In the future, we will be providing additional updates as they come to us. So be mindful of that and look for additional updates. Time, I'll open it up and pass it along to Dr. Wong, who will get us started.
Yeah, thanks, Alon. And just to clarify, if people have questions, there's a Q&A box that people can use to ask questions. I think the chat is going to be disabled for our attendees, but we may be putting links in there in the chat box. We'll be sending out links as well to the group that we're going to reference here. All right, so thank you all for joining. And today we're going to be talking about COVID-19 vaccines. So our objectives today, one is we want to be helping to build vaccine confidence. And that's really, I think the biggest thing that we want to do is to help build vaccine confidence. And how do we do that? How do we help people become more confident in vaccines? I think we do that by giving information about vaccines and correct information and hopefully answer the questions that people have, because people have a lot of questions. So giving the best, most accurate information that we can is really what we're going to do. We're going to spend a lot of time talking about the details of how vaccines work and that kind of thing. We're also going to talk about what vaccines mean for Didi Hirsch. What does it mean for us, about how we're working, about how clients and patients are coming in to work with us as well, and then hopefully answer a lot of your questions. We have a lot of information in our slides, so we're going to go through them and hopefully get to a lot of your questions, but we're going to have time at the end as well to answer questions. So if you have those, again, you can put those in the Q&A box. Okay, so first off, we're going to talk about vaccine confidence. And, we really should have confidence in vaccines because vaccines are one of the greatest achievements of the 20th century. They've done so much as far as being able to save lives, improve lives, and increase quality of life for millions of people, right, over many years now. But that being said, people do still have questions about vaccines. And so, again, we want to give as much accurate information as possible to people. I think it's also important to think about, vaccine confidence really starts with all of us, right? It starts with all of us as individuals, and it starts with you. And I think there are things that a lot of us can do to help increase vaccine confidence in the people around us. One of those things that we can do is we can get the vaccine, right? So getting the vaccine will protect yourself, protect loved ones, protect family members, protect your community as a whole. And I think that's part of the process as far as how we can help to increase confidence for other people as well. Once you get vaccinated, you can also share your story with other people. I think, hearing from other people who've been vaccinated, especially people loved ones, that kind of thing can be really helpful. So sharing your story is an important part of increasing vaccine confidence as well. And then encouraging other people to get vaccinated, right? We know it's really important. We know it's going to save lives and already saving lives. So we want to encourage as many people as possible to get vaccinated. Another reason why it's so important to have vaccine confidence is because we need 70%, maybe even 80% or more of people in general to get the vaccine to be able to have herd immunity, to be able to protect everybody. So, we need the vast majority of people to get the vaccine. Then that's going to take confidence. It's going to take a lot of us feeling good, feeling confident in that decision to get the vaccine. Okay, so this is a piece of art by a street artist named Banksy. He did it last year, I think in response to the pandemic. And I like it because, and it's called Game Changer. And I like it because I really like this idea of being a game changer. And, you know, in this picture, it's a nurse that is kind of the hero for the kid. And I think, you know, nurses, I think the medical field, I think we have that opportunity and that responsibility to be heroes in some ways, but I really think that extends to everyone, right? Even if you don't work in the healthcare field, you can still be a hero. You can still be a game changer and still really make a difference for people that you love, for your friends, for your loved ones, for your family, for your entire community. So we're going to review a little bit the kind of current situation of COVID. I think people are probably pretty well aware. We're hearing these numbers all the time. We know the situation's been pretty bad, but want to review a little bit. So in the US, currently there's been over 27 million cases. There have been over 460,000 deaths in the US, a very unfortunate number. And more deaths from COVID than from World War I, the Vietnam War, and the Korean War all combined. So, you know, it's such a huge number. I think it's sometimes really hard to wrap our minds around what that means. But it's a staggering number, right? It's a huge amount of loss. And for the people that have been affected directly, you know somebody, have a loved one that died, you know, they're feeling it, you know, in a really big way. So I think it's important to keep that number in mind. Also, as a comparison, you know, people talk a lot about COVID and the flu, and is there a similarity? So one statistic to think about is that 22,000 people died from the flu in the last flu season for the year. So 2019 to 2020, 22,000 people died. And that's roughly around the number of people that die usually a year from the flu. We had 22,000 people die, so the same amount died from COVID in 1 week during our pandemic. So I think this shows kind of the severity and how much worse COVID is, and you know what a difficult situation we're going through right now. So this is cases in Los Angeles County, and you can see we're over here. So over time, cases have obviously kind of increased and decreased over time. We are still in our third wave of the pandemic. So obviously this winter has been a very challenging time. Luckily at this point, cases are going down and going down significantly. But that being said, we also don't want to let up. It's not that we're safe. We're not out of the woods. Cases are still higher now than they were in any of the other waves that we've had in the past. So good news and bad news mixed in there. And this is deaths in LA County. So the deaths tend to lag behind cases. So the deaths, we're still seeing really high numbers, but hopefully we'll start seeing those numbers to start going down as well. We're also seeing headlines all the time, right? We're seeing headlines about how much suffering people are going through, about hospitals being overwhelmed. This winter, again, has been a really challenging time. Luckily, we're seeing some light at the end of the tunnel and hopefully coming out of it soon. But it's been a really challenging time. Another thing that the pandemic has done is, I think it's really highlighted or pointed out for a lot of people, the health inequities that already exist in our country. So even before COVID, we know that our clients that we work with in mental health died 10 to 25 years earlier than the general population. And that's a large part of that is due to not having good access to basic primary care. So those are things like being able to get basic treatment for things like diabetes, high blood pressure. So we already know, prior to COVID, there is inequity in the system. We've also seen data during the pandemic that reinforces this as well. We know that people with illnesses like schizophrenia are associated with a 2.5 times increased risk of death from COVID than the general population. We also know that COVID is affecting minority groups more. In California, 50% more Black and Latino people die of COVID than whites and Asians. It's a huge disparity there. We also know there's a difference in levels of vaccine confidence, with, at least for one study, Asian being the highest at 83%, Hispanic 63%, white 61%, and Black below us at 42%. So It's a really challenging situation, especially for certain groups, right? Certain groups that have historically been underserved. And so there's also, I think, a real opportunity there, and in some ways a responsibility there. I know for us as healthcare workers, but I think for everybody as a community to come together and try to help everybody. So obviously a lot of challenging times, a lot of bad news, but there's also hope, right? So there's hope, and there's really great news that we're getting now with the vaccines. And we can now protect ourselves. We know we can protect ourselves, our loved ones, our coworkers, clients, our community, by doing a few things well, right? And so these are things that are simple, but not always easy, right? So we can get vaccines, both COVID and flu. We can continue to social distance. We can wear masks, and we can wash our hands. And we know that even now that vaccines are starting to go out, we're still going to continue to have to do all of these things, right? So we still have to social distance, even if we get our vaccines, still wear masks, still wash our hands. And you know, these things, again, they're simple, but maybe not always easy, right? I may not be able to social distance 100% of the time because I have to work and I have to be around other people, or I live with other people, or whatever the case may be, right? But as much as we can, we need to try our best to do all these as much as possible. Okay, so a little bit on the flu vaccine, just because as a reminder, obviously flu vaccine is something that people typically get every year. The flu vaccine is recommended for people 6 months and older, especially in vulnerable populations, and we're talking about, you know, who are some of those vulnerable populations. You shouldn't get it if you're currently sick, which is the same with COVID, or the COVID vaccine. LA County also has some resources for free vaccines for people that may not have health insurance. Kaiser, for people that have Kaiser, they have a lot of ways that you can access flu vaccines. You can also get it through your primary care doctor, and then pharmacies also have vaccines available as well. Okay, so let's get into now kind of the meat of what we're here to talk about, which is the COVID-19 vaccines. So far there have been 2 that have received FDA emergency use authorization. We're also expecting others in the next, you know, weeks to months. The 2 that we have so far are both 2 doses. One is 21 days, one's 28 days apart. And there is actually a window. You ideally get it 21 or 28 days apart. There's a window of you can actually get it 4 days early, all the way up to 6 weeks late. So you should still try to get it if you can't get it on that exact day. You also don't need to restart it if you get it late. You don't need to restart the series. So you still just need 1. Even if you're past 6 weeks, you just need 1 more shot. You should just get it as soon as possible. The vaccines were also studied in a diverse population, so across age, gender, and ethnicity, and there are no differences across the group. So we have a lot of confidence that it works in the majority of people. There's also a lot of research still going on for other vaccines. So there are 61 vaccines that are being studied in later stage human trials, and 172 that are also being explored in earlier trials. All right, so let's talk about the first one that got approved or got emergency use authorization from Pfizer. So an important difference for the Pfizer one is that it's for ages 16 and up. The Moderna one, the other one we'll talk about, is for 18 and up. So you know, only a couple of years there, but a big distinction between the 2. And really, I think kind of the main distinction between the 2. So they studied this vaccine in thousands of people, 43,000 people, so a very large group. And basically what they did is they randomized the people to either get a placebo or to get the actual vaccine itself. And then they followed them over time and saw who actually got COVID. And the results are very dramatic. So in the placebo group, 162 people got symptomatic COVID. And in the vaccine group, only 8 people got symptomatic COVID. So a very big difference, which is great news for us. An important point too is that what they were looking for is symptomatic COVID. So we actually have less data about asymptomatic COVID. So there's this question of, you know, can you still get COVID, not have symptoms, even if you've gotten the vaccine, and pass it on to other people? There's evidence to show that it helps with asymptomatic COVID as well. just not as much data as we have about symptomatic COVID. So we're very confident around symptomatic COVID and still need more time and more study around the asymptomatic question. But that just kind of reinforces the idea of needing to continue to social distance, wear face masks, and wash our hands even after we've gotten the vaccine. So besides symptomatic COVID, they also looked at severe cases. In the placebo group, there were 9 severe cases, and in the vaccine group, only 1 severe case. So not only does it prevent people from getting symptomatic COVID, but it also prevents people from having severe cases. So overall, they found 95% efficacy, which is an amazing result, a really great result. And again, across ages, gender, and ethnicity. And the Pfizer one, you get 21 days apart. So 21 days late after you get your first dose, you should get your second dose. And this is a graph that basically shows those same results. The horizontal axis is just the number of days after you got your first shot. The vertical axis is just number of cases. So the red line here is the placebo group. So people who got placebo, you can see over time, the number of cases just kind of steadily continues to increase. The blue line is the vaccine group. So this is people who got the active vaccine. You can see in the beginning, as the vaccine is kind of starting to work, your body's building up its immune response. Cases are tracking along with the placebo group. Around day 10, 14 though, there's a pretty significant change, right? There's kind of barely any cases after that. And the line is almost flat, right? With only a few increases. So a huge difference, again, showing the very dramatic results, really impressive results that we have with the vaccine so far. Okay, so that was Pfizer. We're gonna talk about Moderna, which is the other vaccine that has emergency use authorization. Very similar results. Again, big difference here, 18 and over versus Pfizer, which is 16 and over. So again, studied in tens of thousands of patients, 30,000 patients. Again, they looked at number of people that got symptomatic COVID, 185 in the placebo group, only 11 in the vaccine group, so a huge difference there. They looked at severe cases as well. There were 30 in the placebo group and 0 in the vaccine group. And then there was 1 death in the placebo group and no deaths in the vaccine group. So again, very dramatic results, great results. Almost the same as Pfizer, 94% effective. This one's a little bit different. You get the second dose 28 days after the first dose. So in these studies, they also looked at the immune response. So how your body builds up immunity, and found basically a very robust, a very strong immune response across various things, including antibody titers, virus neutralization, and T-cell response. And actually found that the immune response from the vaccine is higher than the immune response, your body's response from natural infection. So very good news there as far as the vaccine. One thing we don't know is exactly how long the immune response is going to last. Just because we don't have that much time studying it. But there is some initial information or initial data, which is really good. We, looking at the response from the vaccine, looks like we have stable antibodies for at least 4 months. So at least 4 months, we're pretty confident that people are going to have good immune protection. And for natural, we have more time studying that just because it's been around longer. And we see that immunity seems to last at least 8 months in most people. And again, we're thinking that the vaccine has a stronger immune response. So, pretty confident that, at least 6 to 8 months, and we'll probably, we'll be learning more over time, but so far so good. It is possible that people may need booster shots. So like we get an annual flu shot. In the future, it may be that we need to get an annual COVID shot, but that's just something that we're going to learn more with time. Okay, so side effects. So an important topic. Vaccines do have potential side effects, and so we do have some good information about potential side effects from the studies as well, and from the information of people actually getting vaccinated afterwards. So vast majority, if people do have side effects, vast majority are mild to moderate, right? So not really going to have that much of an effect on people. More so after the second dose, your body's had the ability to kind of build up that immune response to the first vaccine. So the second time your body sees it, this response is bigger and the side effects are bigger. And the side effects are actually a good sign, they're good news, in that it's showing that the vaccine has its effect, that the body's building up an immunity, the body's working, right, and fighting it off. So it's actually a good sign. From the studies, we have 2 months of safety data. And some people, I think from some perspectives, might say, oh, well, 2 months doesn't seem like that long. But for vaccine side effects, it's actually a pretty, it's a good amount of time. And I think we can feel pretty confident, as far as the data that we have. Because most vaccine side effects, if you're going to get a side effect from the vaccine, it's usually going to happen in a couple of days, maybe on the order of days, maybe weeks, for when you might have a side effect. So having 2 months, I think we can be pretty confident in the results that we've seen. And we're continuing to get more information as more and more people get vaccinated. So this is a list of some of the common side effects in order. So the stuff at the top is the more common, stuff at the bottom is less common. I'm not going to read all of it, but some of it is pain at the injection site, fatigue, headache, muscle pain, joint pain, diarrhea, chills, nausea, vomiting, etc. So for the studies, they also looked at serious side effects or serious adverse events. For Pfizer, they basically found almost equal amounts for the vaccine group at 0.4% versus the for the vaccine group versus the placebo group. One thing they did note is there were 8 cases of appendicitis in the vaccine group, or in the placebo group. Of these tens of thousands of people that they looked at, these numbers are very small, so it's really not clear what this means, but something that they're going to continue to look at time and get more data about. So Moderna, again, very similar amounts of serious adverse events, 1% in the vaccine group and placebo group. They did note 2 cases of facial swelling with people that had prior filler injections, and also 1 case of intractable nausea and vomiting in somebody that had a history of being hospitalized for headaches and nausea in the past. Okay, so one question that comes up, and I know that here at Didi Hirsch we think about this, is if you get side effects, we're expecting some side effects, can you work? Can you come into work? And each work site is going to have kind of their own protocols and things that they follow, but to give people a sense of what we're doing, and this is based off of public health guidance or recommendations. And a couple things too to think about. One is, try to get your vaccine prior to having a couple days off, like 1 or 2 days off if you can, because you might not feel great, so you might want to rest. So ideally you get it before you have some time to rest. Also for work sites should be thinking about staggering vaccinations. So you want everyone to get the vaccination on the same day, because if everyone's not feeling great, or if a significant amount of people are not feeling great the next day, then you're not going to have people to work. So think about staggering it, have one group go 1 day and spread it out, over time. So for Didi Hirsch, again, this is based on public health recommendations. For us, our staff is allowed to work with mild to moderate fatigue, headache, chills, muscle pain, joint pain, nausea, diarrhea, and all of the following criteria. So they're allowed to work with some symptoms in the time immediately after getting the vaccine, if they feel well enough to work, if the symptoms started within 2 days of getting the vaccine, they don't have any fever, they don't have any atypical symptoms like cough, shortness of breath, runny nose, sore throat, loss of taste or smell. They haven't had close contact with somebody that was sick in the last 14 days, and their symptoms resolve within 2 days of onset, so they go away pretty quickly. All right, so there are also some groups that we want to have some caution in. So there's actually contraindications for the vaccine, meaning some people shouldn't get it. And that's if you've had a severe allergy to components of the vaccine, which include mRNA, lipids, stabilizing salts, and sucrose. Also, if you have an immediate allergic reaction to the vaccine, so if you get the first vaccine, you have an immediate allergic reaction, which is very rare, but if you do, to the vaccine or any of its components, including polyethylene glycol or polysorbate, then it's also a contraindication. There's another group too that we want to have a precaution in. So if you have an allergy to other injectable medications or other injectable vaccines, then you should be monitored for 30 minutes after you get the vaccine versus 15 minutes. 15 minutes is standard of what you should be monitored for. But in this group, you would want to monitor for 30 minutes. Also, again, you don't want to get the vaccine if you're currently sick. And that includes actually both the isolation period and the quarantine period. So If you're still in isolation, you shouldn't get the vaccine. Or if you've been exposed and you're in quarantine because you've been exposed to somebody with COVID, you also should not get the vaccine during your quarantine period. And then there's also a 2-week window before and after where you should not get other vaccines. So meaning if I get the flu vaccine today, I should wait 2 weeks before I get my COVID vaccine. And there are also some special groups too. So there's limited safety and efficacy data in certain groups, including pregnant people, breastfeeding, immunocompromised, and people with HIV. The reason is some of these people were not allowed into the study. So specifically pregnant people were not allowed in the studies, breastfeeding people were not allowed into the studies. And then if you had an unstable medical condition, you were not allowed into the study. So they actually allowed people with lots of medical conditions to be in the study if they were stable. And stableness for the studies meant that they didn't have any significant change in their treatment and they weren't hospitalized in the past 3 months. So if you had a stable medical condition, you could be in the studies, including if you had autoimmune disorders, diabetes, high blood pressure, even things like HIV. So they allowed a lot of people in, but there's just some limited data for certain groups. In general, the vaccine is still recommended for a lot of these groups. And also, needing to keep in mind too, that people with chronic medical conditions a lot of times are a higher risk for having a more severe case and even death. So that's also something to keep in mind. Another special group is people who had a prior COVID infection, and if they got treated with COVID antibodies. Treatment with COVID antibodies is not that common, but if you had COVID, if you were treated with antibodies, you should wait to get the vaccine at least 90 days from when you got the antibodies. And then people who prior had COVID, but were not treated with antibodies, but you just had a COVID infection, you should still get the vaccine. And the thought there is that the protection from the vaccine is actually going to be better than the protection from natural infection. One thing though that you can do is you can actually delay it 90 days from when you were sick, because we're pretty confident that in those 90 days, you're going to have good natural immunity. And especially if there are, if the vaccine is not available, or if there's just not that much vaccine, you can defer it for 90 days. All right, so let's talk a little bit more about pregnancy. Pregnancy is obviously a very sensitive subject. So like I said, in the studies, they didn't allow pregnant women into the studies. However, people became pregnant during the studies. So people got the vaccine, they weren't pregnant. And then during the course of the study, they became pregnant. So there is actually some information. It's limited though. So in the Pfizer study, there was only 23 people that got pregnant, 12 in the vaccine group, 11 in the placebo group. There were some adverse events. They were all in the placebo group. So things like miscarriage. And these are things that naturally happen, right? So there were these adverse events, again, only in the placebo group, so nobody who had the vaccine. And the bottom line with pregnancy is that pregnant people should still be offered the vaccine. At the same time, they should also be informed that there is a lack of data, right? There's not very much data. We've seen very few pregnant people, though more as the vaccine's rolling out, getting vaccinated. Another thing to consider at the same time with the lack of data is that pregnant people may have an increased risk for more severe illness and death, right? So it may be even worse, and we know there's lots of risks that go along with COVID, especially for pregnant people with obesity and diabetes. And those are things that can develop during pregnancy. So the American College of Obstetrics and Gynecology also recommended that people who are trying to become pregnant don't need to delay becoming pregnant. So if you got the vaccine, you're trying to get pregnant, you can continue to keep trying to get pregnant and get the vaccine. All right, so let's talk a little bit about COVID variants and efficacy of the vaccine. This is a big topic. We're hearing things in the news all the time about this. So there are new mutated variants of COVID. That's as expected. That's what viruses do, right? Viruses mutate. And the more opportunity, the more cases there are, the more chance that we're going to see mutations. So we've seen kind of three main ones that people are talking more about: British variant, South African, and Brazilian. and there's evidence that these are maybe spreading more. It's unclear. There's no clear evidence that they're more dangerous. There's a little bit of evidence that maybe the British version can cause more severe disease, but it does look like they spread more. There's also evidence that the vaccines still work in these variants. They may work less well in some cases, depending on the vaccine, depending on the variant, and those are things that are continuing to be studied, but they still work. And still working is a very important thing. You know, when we think about vaccine efficacy, it's not 100% or zero, right? Because even if it doesn't prevent you from getting COVID, it may prevent you from getting severe disease. It may prevent you from going to the hospital. It may prevent you from dying. So we'll talk a little bit more about that. But these variants, I think, also highlight the fact that we need to do all that we can now. We really need to make all the efforts that we can now, get people vaccinated, do all the basic things like social distancing, wearing masks, washing hands now, because we don't want to have more and more cases and more chances for there to be mutations and other variants that continue to pop up. Some good news too around the variants is that because of the advances in how vaccines are made, new vaccine can actually be made relatively quickly, on the order of, I think, weeks to months, is what some of the vaccine companies are saying at this point. And they're already looking at, you know, potential upgrades to the vaccines or booster shots that they might come up with to help with some of these variants as well. So going along or continuing with this idea about variants and efficacy, to me, this is one of the maybe the most important piece of information that we're going to talk about today. So we've got the different vaccine trials. So Moderna and Pfizer, the vaccines that are available now, we've talked about. Some of the ones that we're looking at that are maybe coming out soon, Novavax, AstraZeneca, and J&J, or Johnson & Johnson. Here's a number of people that got the vaccine in each group. So overall, it's around 75,000 people in the studies that have gotten vaccines. Obviously, you know, now millions of people have gotten vaccines as well after the studies. But from these trials, a really important thing, we're talking about efficacy, and maybe with the variants, vaccine may not work as well as far as preventing people from getting COVID. And these trials had people, you know, there were people with variants in these trials as well. But what we've seen in these trials is that, so this column here is the number of people that were hospitalized with COVID. So you can see number of people hospitalized in all the trials of all 75,000 people, 0. Next column over is number of people who died from COVID. Again, across all 75,000 people, all the trials, again, 0. No people hospitalized, no people died. There were a few cases of COVID. You know, people still got COVID in much lower amounts, but nobody was hospitalized, nobody died, right? If we can get rid of hospitalizations, if we get rid of severe disease and from people dying, that's also a way that we can get out of this pandemic. So I think that's a really important thing to keep in mind. And the last column is also the number of people that died from the vaccine itself. No people have died from the vaccine in these studies. All right, and with that, I am going to turn it over to Nurse Sandra.
Hello. Okay, well, Dr. Wong did a great job of letting us know everything about this vaccine. So let's talk about mRNA vaccines. So essentially the mRNA is like, it's a messenger. It just drops off information into your body. It doesn't actually affect any part of your DNA, and it's a weakened inactivated virus. And the vaccine gives a code to a small part of the virus itself. So in other words, there's this protein spike that is actually causing all the problems. And it's sort of like UPS, if you will. It just drops off more information to make things better for you, so that the body can build up an antibody to help fight the virus itself, so that you don't get as sick. So then the body becomes protected. Then we'll move to the next one. mRNA vaccines, newer vaccines. Yeah, they've been studied for decades. So in other words, even though we weren't aware that this particular virus was going to be out there to harm us and kill us and whatnot, we actually have what I want to call a head start. So they were already working on mRNA vaccine, scientists preparing for unknown viruses that would affect us that we didn't actually have names to. So it's been in the works for quite some time. And so that's why they were able to actually have a vaccine ready so quickly for us, because they usually take time. It never actually gets into your DNA. Your DNA is what you're born with. That is your blueprint, the map of who you are. So this particular vaccine never actually gets in there to disrupt any of that whatsoever. The mRNA breaks down into the enzymes, and it apparently has a way of building stability and effectiveness. And it doesn't lead to positive PCR antigens. But made for, it actually helps our body actually. So we build up antibodies. So essentially, if we get infected with COVID, even after being vaccinated, it builds up. What we don't know, can you still infect others? Well, we haven't been able to determine that just yet, because not everyone has been vaccinated, and everyone doesn't have to necessarily go that far, but we don't know what it's going to do just yet. We're still in the trials of it. We still want you to social distance. So you still want to stay with 6 feet from others, wear your mask, and wash your hands regularly. So you'll probably, if you're out in public, you're gonna wash your hands before you touch your face. You're gonna wash your hands before you get food and eat. You'll wash your hands or use hand sanitizer when you get back into your car or walk away from a public place. What we don't know, again, the long-term effects. We still don't know what that will be for us. We know that in the short term that there are people that they're not being hospitalized. They're coming into contact with COVID and they may get it. But what happens, it's like when you get the vaccine, since it develops that, it is that protein spike that the COVID is making everyone so sick. It helps us to build that antibody. So when it comes around, so like an example would be, you had a situation with someone a few years back and they were really mean to you. Okay, that's the COVID spike right there. And then all of a sudden you all are out one day having this gathering and the COVID spike comes back, but you kind of forgot all about it. Well, this vaccine helps with basically as friends. In other words, they remind your body that this is not a good thing. That's the one that came and did such harm before. So it essentially helps to keep you safe so that those T cells come in and fight it and help protect you and continue to build antibodies for you. And the long-term effects of COVID can be serious. It can lead to death. Some people are actually realizing that they have COVID, and then all of a sudden they're in the hospital within a week, and a week later they are passing away. But this vaccine is going to help eliminate that, or at least reduce it. The risk of the COVID vaccine. 1 in 7 people are hospitalized from COVID, and 1 in 50 actually die from it. And 1 in 1 million die from vaccines. So that's a smaller ratio there. So your safety is going to be more likely to be safer that you won't die, but you will have a higher risk of dying if you actually have COVID. And it says 30 to 50% of COVID patients do not fully recover weeks to months out, meaning that they're dying. So in other words, these are patients that never actually received the vaccine. So the ratio of actually being alive after having the vaccine is a lot greater right now, as far as we know. And and safety standards have not been relaxed. So essentially, we still want you to be safe. We still want you to wear your mask. If you have a shield, you'll wear that as well. We still want you to be aware of your surroundings. So when you're standing in line, getting food or buying something at a store, make sure that you keep that 6 feet of social distance. And to be careful of who you're around, making sure if you see your friends and they have their mask underneath their nose and they're not actually covering, ask them to pull that up. Because that mask is not only just protecting you wearing a mask is showing them that you care about them, that you want them to be protected as well. And there are people out there that don't actually understand how to wear their mask, though. You, in a nice way, can say, hey, can you pull that up over your nose so we can keep each other safe? In the phase of the clinical trials, and there are 4 phases. And the first phase was phase 1. And that was researchers' way, or in other words, the healthy volunteers that came in. And that would be like myself, in other words, a healthcare worker who has direct contact with people to determine, to help keep me safe so that I can keep the people that I'm working with safe. And then in phase 2, actually, Dr. Wong, can you talk about this phase of the clinical trials?
Yeah, sure. Yeah, I think, not to go through all of the details of it, I think kind of the takeaway is that, there's 4, typically for clinical trials, there are 4 phases. COVID vaccines went through the same 4 phases. They were able to kind of get through them quicker, but they still had to go through the same rigorous process in order to get approved or to get authorization. And I think this here is, again, somewhat similar with the idea that there are processes that have to happen to get approval. So there are 2 independent review committees with scientific experts, clinicians, researchers, et cetera, experts in their field that are independent from the FDA or independent from the CDC, and they come together and make a recommendation about whether or not vaccines should get authorization. So same processes, same kind of thorough vetting system has to happen for vaccines to get authorization. Sandra, do you want to take this? You want me to?
I'll let you take that one as well, please.
Okay. Yeah, so this one basically is a similar idea of there's not only were there the studies, but there's after study ongoing monitoring systems in place for vaccines. So there's 4 different systems that actually exist already. And for COVID, they actually came up with a 5th system in addition to the 4th. There's another 5 monitoring systems to make sure that we have all the information we can about, are there, any safety issues, things like that with the COVID vaccine. And so far the results have been good. And then, some people ask this question about, how did we then get the vaccine so quickly, right? This happened much quicker than other vaccines in the past. So there's a few things that went into, or reasons why we were able to do it so quickly. One is they used existing clinical trial networks. So they kind of had clinical trials set up for other things, booted those things and put in the COVID vaccine. So we kind of prioritized the COVID vaccine because of the pandemic. They also started actually making the vaccine while they were still testing it. So they started making a bunch of the supply. And they were able to do that because of investment by the government to be able to, fund that even before the results were out. Also, just because of the way that mRNA vaccines are made, they're faster to produce than traditional vaccines. And then the last thing is that the FDA and CDC just made this a priority, right? They said, okay, pandemic's going on, all the research that we need to review and things like that, we're going to put COVID vaccines at the front of the line because they're a higher priority than, let's say, a blood pressure medication that's new or something like that.
Okay, vaccine rollout. So 20 million people were to be vaccinated in December, but it was actually 3 million. And in January, the expect was 30 million, but 20 million actually. And in February, 50 million, and ongoing 75 million moving forward. Phase 1, healthcare workers and long-term care residents. So that would be someone like myself, and even Dr. Wong, someone that has face-to-face contact with people daily, for myself, within inches of another person. And then there would be people living in like a senior living center or any type of home, a residence where they would actually have possibly a roommate would be the first part of phase 1. Phase 1B, 65 plus, and frontline essential workers and all healthcare workers. This was to be started for February on and into March, so they would be next in line.
Yeah, and Sandra, just to piggyback on that, an important point is that so right now, people 65 and over are able to get the vaccine. So, not if no matter not a healthcare worker or anything else, but healthcare workers, obviously long-term care facilities and people that are 65 and older can now get it. It's obviously challenging from what we're hearing for a lot of people to get their vaccines still, even if they are 65 and up.
Yes, that's right. And so phase 1C, so that would be people ages 50 to 64 would be able to get their vaccine now, starting in April. And then 16 to 64 with high-risk medical conditions. I believe Dr. Wong had discussed those earlier, and we can go over those again. And then other essential workers, so that would be people that just work in at any particular store, people that have to help us with the purchase of our food and maybe gasoline and other things that we need. And that would happen through the month of April through May. And here we go, high risk medical conditions. So the people that would be at high risk that we just discussed would be those that were pregnant, those with cancer, chronic kidney diseases, and COPD, which would be a respiratory condition, like the end stage of any respiratory disease. Heart conditions, those have immunocompromised immune systems, from organ transplants, those that are overweight, those with sickle cell, and a history of smoking, and then those with type 2 diabetes would be in those categories. Phase 2, the general population, so that would be everyone else starting in May through June. Where to get vaccinated? So you can start with, we have this number online for the Department of Public Health. You would start there by calling that number, and they would direct you to where you can get this started or who's going to be doing what and when. You can also call Kaiser's appointment line to get information on where you can go and how to get an appointment to get vaccinated. Your PCP, your primary care doctor, who you would see in the event that you usually go and you're not feeling well, would be your primary doctor. You would start there to see if they're going to be doing this or where they would direct you. And then as well as pharmacies, as some of you might know, pharmacies actually give flu vaccines. So the pharmacies will actually be giving out, and there I believe CVS Pharmacy is going to be doing the COVID vaccine as well. And vaccine experience. So in this picture, this is Dr. Wong actually, where he went through LA County Department of Mental Health to get his vaccine. And everything went well for him. He actually let them take a picture of it. I didn't have a picture in the slide, but I did myself receive the vaccine. And actually prior to getting the vaccine, I did inform my children that I was doing this, and they were concerned about me having it. They are on social media quite a bit, playing live and video games, and their concern was that if mom gets this, she's going to turn into a zombie. Well, I'm not a zombie. And today, late today, I will go in. Here's my card. I'm going to go in later today to get my second dose, my booster, if you will. I'm doing quite well, and I'm not too all concerned about any of the side effects of the second booster. The only thing you need is to bring your confirmation when you do get that appointment. You will want to bring identification so they know who you are. And you don't have to have proof of insurance or your immigration status for the US. You don't need that. Dr. Wong, did you want to include anything here?
Yeah, and I can talk a little bit about my experience. So yeah, just to reinforce what you're saying, when you go on the website too, and I think we shared that link in the chat, when you go on the website, the documentation that they want kind of changes. I think it's changing over time depending on which groups are going. So just make sure you look at that and make sure you know what documentation you need to bring. And yeah, I mean, I think so from my vaccine experience, I think like a lot of people, I know 6 months ago, people were asking me, when the vaccine comes out, are you going to get it? And my answer was always, I don't know. Like, I'm going to need more information. I can't tell you at this point because I don't have all the information. So for me, I think I had a lot of questions about it. I think like a lot of people do. And then I educated myself and I got more information and I read the studies, and now I feel very confident. And so I actually got the vaccine myself. And I've gone twice now. I got my second dose as well. So the first time that I got it was through the county. So I went through the county system. There was a long line. I did have to wait, 2.5, 3 hours. So it was a pretty significant wait. So be prepared for that. That was pretty early on too. So, hopefully things are getting better and the process is a little bit better. But the first time I got my vaccine, my arm hurt for a couple days. Otherwise I was fine. Second time, I actually went through Kaiser, and Kaiser, better experience as far as wait time. I had to wait, let's say 20 minutes. As far as side effects, I did have more side effects, and that's what we expect after the second time. And that's what we're hearing a lot, kind of anecdotally, people were talking about having, a little bit more side effects after the second one. For me, I had some nausea, I had chills, body aches, never got a fever, but I just, overall wasn't feeling great. And I had to, take most of the day hanging out in bed. But it also went away pretty quickly. So it went away in about 24 hours, and I've been fine since. So again, I think, my experience, I think is somewhat typical in what a lot of people are experiencing. And we also have, I think, Alon, you got your vaccine. I forget how many you've gotten at this point. You want to share your story?
Sure. I received my vaccine on Monday, actually. Got my first dose on Monday. So less than 48 hours ago from right now. I'm doing fine. I have a little soreness in my arm. It kind of feels like I threw a football or threw a ball for too long for a few hours and just got a little shoulder soreness. But just doing some stretching on my shoulder, and it's feeling well. I was lucky enough to receive the vaccine at one of the Didi Hirsch residential programs, which is something that we're able to support and provide to our clients as well. Thankfully, there was a lot shorter of a wait time that way as well. And similar to as what Dr. Wong mentioned, I attended a lot of webinars and I read all of the links that I've been posting in the chat to learn as much information I could about the vaccine before I felt truly confident to get it and confident to disseminate the information to other people as well.
Yeah, then Jonathan, I think you got your vaccine. Do you want to share your story?
I sure did. So I got my vaccine, the Moderna, and this is kind of like the badge of courage for everybody. And yeah, the vaccine, the first shot I took, I didn't really get too many symptoms. I just felt soreness, like if I had just worked out for a while. And that only lasted for a couple of days. So I was glad that, I take the flu shot occasionally, once a year. Sometimes I may not take it. And with the flu shot, I actually seem to get a little more symptoms. With my second shot for the vaccine, I did get a slight fever. It was a low grade. It stayed at 99 degrees. And I had the fever for about 4 hours. I took Tylenol for it, and I was fine. And for that one, I did feel some soreness on my arm, like if somebody had punched my arm. And the soreness went away after a few days. I actually got the shot on Saturday. So it's now been 4 days. So really the symptoms, only felt the symptoms on Sunday. Monday I felt better, and it's been great, and I recommend everybody get it if you have anybody in your family that you're concerned about, because my family has been affected by it, and just seeing what they've gone through, I don't want to put any of my other loved ones through any type of risk. So yeah, this is great information. This is just educational, just knowing that this is not a harmful thing to do. So please consider that.
Thank you. What is Didi Hirsch doing? Well, we're open. We're not closed. We're here for you. We're here to take your calls and any questions or concerns. Also, we're still, we're able to see you through telehealth, where you might do it over your phone, or maybe you might come into our site and we'll have a cleaned area for you to meet with, whether it's your doctor or your therapist or care coordinator, and you would do it via telehealth. So if you haven't had a chance to experience that yet, it's real time, it's not recorded, and it's you can do everything that you would do if you had come in here and met with someone face to face. The only thing you can't do is shake their hand. And we have many people, quite a few people are working remotely. They're not on site, but they're still able to meet with you via the telephone, or they can actually do a telehealth with you if that's something that you are able to do. We're also doing presentations, and like today, and I work on site. Actually, I'm here at the Culver City site 3 times a week that I meet directly with patients here. And I educate them. I'm asked a lot of questions about the COVID vaccine. Am I going to do it? And I've been able to tell several people, yes, I've gotten the vaccine, and that I'm looking forward to that second dose. They update us all the time if any of the safety protocols change, if they need us to do something else. Or I believe at one time we readjusted my office so that I could keep you all safe as well as myself. And we are supporting, Didi Hirsch does support this vaccine. We want everyone to be vaccinated, to stay safe and stay healthy so they can help keep everyone else healthy. There are, like Alon said earlier, he received his vaccine on Monday at one of our residentials. So the vaccine is available on site at some locations, currently not at the Culver City site. What changes on site? Okay, so change takes time. It doesn't happen quick, but we do want you to know that you are safe. We want you to feel safe when you're here. So one of the things that occurs when you walk, right when you get ready to walk in the door, we have someone there that's going to check you, check your temperature to make sure that you do not have one. And there are standard questions that that person will ask you to make sure that you are safe to come on inside. We do practice social distancing throughout our entire facility. When you walk into our lobby, you will notice that there is social distancing. The chairs are set apart so that you're within you're not in the danger zone, that you're allowed to social distance. We do encourage you to social distance at every time. So if you do come into our site or anywhere, make sure that you keep that 6 feet, wear your mask, and wash your hands. We also say that it's the same protocol when you're exposed or sick, that you still wear the mask, you still social distance, you still wash your hands. Let's see, the mandate expected. Dr. Wong, can you talk about the DPH mandate?
Yeah, so, I think, at Didi Hirsch, like I think all businesses at this point are thinking about whether or not we should mandate the vaccine to our workers, to our staff. And for us, it's still a question. And we're really trying to encourage all of our staff to get vaccinated and trying to help people feel more comfortable, more confident with the vaccine. But we have not decided to mandate it at this point. We do, though, expect that Department of Public Health at some point will mandate it to certain healthcare workers. We're not sure who, and we're not sure if it's going to apply to us or not, but something that we're thinking a lot about. And there's kind of like a lot of what's going on, we're going to learn more in the future.
Great, thank you. And we did talk about the telehealth. So in other words, if you are able to telehealth with any of us here, we encourage it so that we can see each other face to face. When we're on the phone, we can get quite a bit done, but it's safe, as well as telehealth is safe too. So you have that face to face time, you're just not in the same space with that person. Okay. Frequently asked questions. Is the COVID vaccine safe? And I'm going to read this. It says there's been rigorous scientific study which has found it to be safe and effective across diverse groups. Most people will have a mild to moderate side effects, which is what you heard Jonathan talking about, Alon and Dr. Wong. So like when you get the initial injection, when I received mine, I actually didn't feel anything right away. It wasn't until I touched it and moved my arm, it let me know, hey, I'm here. But that's just with anytime something actually enters your flesh, you will feel it a little bit afterward as well. Is this new type of vaccine going to change my DNA? We talked about this earlier. No, your DNA is what you're born with. That's your map. That's your blueprint. That's makes you who you are. Okay, so the mRNA, the messenger RNA, it's just that. It's like a courier. Basically, it brings, it's like a delivery person. It brings information to the center of where the DNA is, to help the body to build up the antibodies and like this says, to build the protein and break down any of the enzymes from the, and it breaks down into enzymes, I'm sorry, and then it goes away because it just delivers it and it leaves, okay? So, and when will I get the vaccine and how? So most people will get the vaccine in the spring or in the summer. Healthcare workers, residents of long-term care facilities, that was the first group. And those that are 65 and older, they're getting it now. They're able to do that. And older people with pre-existing conditions that we discussed earlier, and other groups, certain other groups will get it earlier, will get it sooner. And let's see, and to get more information, you definitely talk to your primary doctor. They can also direct you. You can talk with Kaiser, as we mentioned that earlier, and LA County Public Health. Frequently, do I still have to wear a mask? Yes, we're in a pandemic. It's not over yet. Look at masks at this time as this is you've been here, not to sound cliche, but it is our new normal. We're gonna be wearing masks for quite some time. To keep protected and washing our hands. And even if you know that the group you're around has been vaccinated, you still want to wear your mask. Do you have to pay for the vaccine? No, it's free. Let's see, it says that some doctor's offices may charge for their services. Maybe there's a co-fee, some kind of little fee, but no, for the most part, it is free. It says if someone tries to charge you, let's see, to get vaccinated, it's a scam. Yes, it would be. If someone's trying to charge you to give you the shot, that is definitely a scam right there. Can I get COVID from the vaccine? No. The small part of the virus, it's an inactive part of the virus. It's just that you can't get the COVID actually from the vaccine itself. It's helping you to build an antibody to fight the vaccine. I'm healthy. Do I really need the vaccine? Yes, there was a person, I believe at the beginning of COVID coming, that we were aware that it was here, that was healthy. They were a dancer. They had no comorbidities. They didn't have any other, they were a naturally healthy person, did get COVID, did go in the hospital, and I believe within a few months they had died. So we didn't have the vaccine at that time, but we have it now. So if you're healthy, you still want to get it. If I had COVID, do I need to get the vaccine? Yes. Even if you've had the COVID vaccine, your body has probably built some type of antibodies to fight it. But this thing is strong, and it's better to keep yourself safe and get the vaccine so that you can get more of the antibodies built up in your system to fight it when it comes back again. Do I need to get a flu shot too? Yes. So we always encourage the flu shot. Even before COVID, we encourage the flu shot to protect you. And it'll also, you want to be protected during the pandemic. You want to stay as healthy as you can. So it would be a lot to have the flu and then come in contact with COVID and acquire that as well at the same time. That could be pretty devastating for you. So get vaccinated. Does the vaccine have a microchip in it? Okay, well, that would be nanotechnology, very expensive. And no, it doesn't. I'm serious. It doesn't have a microchip in it. There's a lot of, like it says, conspiracy. There are a lot of conspiracy theorists out there on social media saying that the government wants to come in and inject us. They made this virus and they're making us sick. No, there is no truth to that at all. That's just something that was made up. It sounds interesting enough, but it's something that's made up in the movies. Does the vaccine cause infertility? Well, there's no evidence that it does. It's another part of conspiracy theories, and there's going to be a whole lot more coming out there saying all the things that it can do to you if you get it. However, COVID, there have been cases where there's testicular swelling, which can lead to scarring, and pregnant women who have had severe cases of COVID have it led to death. So in testicular swelling, if there is some scarring, that could possibly affect whether or not you would be able to, you and your partner become pregnant. Okay, so where can you get more information? CDC, Center for Disease Control. They're online and you can go through their website, and there's many things that you can click on and read. I was just on their website a few weeks back, and it's a simple site to use. It's not hard. It's an easy read to find, and they have search engines where you can type in there what you're looking for specifically, and they'll direct you there. And then there's the LA County Department of Public Health that we've spoke about a few times so far this hour, that you can go and get information where to go and possibly make appointments. So at this time, are there any questions about any of the information that you've heard from Dr. Wong and myself?
So we do have thank you for all the information you provided, and all of the links that Sandra was just mentioning have been placed throughout the chat box. One of the questions that has come up that we didn't get the opportunity to address as much in depth is, we are aware that children are currently not eligible for the COVID vaccine, but can you speak a little bit more about what that might look like in the future and some of the processes that are going on right now to consider children in the studies?
Yeah, so there's studies that have started now, are ongoing now, looking at children. And so they're expecting results probably sometime spring, summer, I believe, is when they're starting to get initial results about children.
Thank you. The other question that comes up quite frequently is, what if people still, based off of everything they've heard from you and heard from everything we've talked about, are just feeling ambivalent about the idea of getting a vaccine and getting a shot? What are some things that they can think of or look into to consider to help support themselves to make a decision?
Yeah, great question. You know, ultimately, you know, it's a decision that people have to make for themselves. I would just say get as much information as you can, right? So, you know, the fact that people are looking at something like this, a presentation like this, and attending this, I think is a really great step. But talk to people you know, right? You're going to know people that got the vaccine. I would say don't talk to people and who are just randomly searching stuff on the internet. But go to good resources, right? Go to the CDC, go to LA County Department of Public Health, and then talk to people that you know that actually got the vaccine, right? Hear from them what their experience was like.
Yeah.
And the last item we have would be—
Sorry, one other thought too about that. Talk to people too that you know that actually got COVID, right? Because ultimately it's about kind of weighing the risks and benefits. We hear this stuff all the time. We're seeing the numbers all the time, but talk to people who have actually done it too, right? Talk to people who got the vaccine, and talk to people who got COVID and what was their experience like, and did they get hospitalized, or did they have some, sort of negative outcome or something?
Yeah. That's great. So to weigh the pros and cons of both sides.
Yeah.
The last question that's come up several times is, do we know if additional boosters will be needed in the future and what that will look like?
Yeah, great question. We don't know at this point. Some people are speculating that it may become something like flu, where you would get an annual shot. So it's unclear. We'll learn more with time. We also don't know exactly how long the protection lasts. My guess, if I have to guess, I would say I think it's probably likely that it's something that we'll get like the flu shot on an annual basis, but we'll learn more with time.
Thank you. I know that stopping this pandemic is going to take tools from all of us, and all of us working together and coming together to succeed. Do you have any other thoughts that you would like to share about things that we can do as a county as a whole?
I'm seeing that there's another question about kind of percentage-wise where we need to get to, I think, for herd immunity, I think is the question. So that's still a little bit of an unknown too, but the estimates at this point are, we may need 70% to 80%, maybe even more of people to get the vaccine to get herd immunity. And I'm sorry, Alon, can you repeat your question?
Sure, thank you. Thank you for answering that question. But I guess the last point of it would be that while we're waiting to see if there are any additional questions that are coming in, is as a group that we're continuing to move towards getting vaccinated, can you just reiterate some of the basic things that as a group we can be doing to make sure that we're keeping waiting for vaccinations to come our way?
Yeah, so I would say, you know, three main things that I think about as being the most important. So social distance, you know, as much as you can, wear masks and do hand washing. I think those, you know, it's simple in a lot of ways, but if we do those things well, it's going to make a big impact as far as number of cases that we have.
Yeah.
Wonderful. Thank you.
All right. Well, thank you all for attending. And again, this will be available as a recorded presentation as well. So thank you all for attending.
Thank you.
Thank you, everyone.
Mm-hmm.